Hi, and welcome back to Student Nurses Success, where today we're going to talk about inflammation and wound healing. Inflammation is a helpful response by the body. However, sometimes inflammation can turn chronic or become excessive, and in those cases, it can cause and complicate some disease states. Now, let's not waste any time and let's get started with our maps. Here's our blank map as we begin. And remember, you can find a link to the maps in the comment section. Now, inflammation occurs rapidly when cells are injured. It is actually a protective mechanism that begins the healing process, and it is also part of our innate or non-specific immune system. And remember, the innate or non-specific immune system are the first responders to go out to an area. Unfortunately, sometimes it can become dysregulated and lead to hypersensitivity or autoimmune responses. And these hypersensitivity reactions are actually excessive immune responses. We're actually going to cover those in a separate video because there's actually four hypersensitivity reactions that we want to talk about. Let's move on and talk about our purposes of inflammation. The purpose of inflammation is threefold. First, it's supposed to neutralize and destroy invading harmful agents, such as maybe pathogens. Two, it's supposed to limit the spread of agents to other tissues. So it kind of keeps those pathogens or those infectious agents kind of in that area so they don't spread systemically. And three, it's supposed to prepare our damaged tissue for repair. Now, there are some inflammatory mediators that play a role. Inflammatory mediators are responsible for most of the manifestations of inflammation. And we know these inflammatory mediators are chemicals that are released in the body and help communicate. So these are chemicals, and these chemicals are released if there is injury or infection. The first of these inflammatory mediators is histamine. Histamine is a vasodilator, and it also helps increase vascular permeability. So it opens up the vessels so that you can get more healing nutrients, more neutrophils to the site in order to, if there's a pathogen there or an infection, to kind of keep that under control. It also increases vascular permeability so that healing agents can get to the tissue more easily. Now, that vascular permeability is actually going to cause some of the edema that we see with inflammation. And that vasodilation is going to cause some of the redness and warmth that we see. Cytokines are also important as part of the immune response. Platelet activating factor also plays a role. It activates the neutrophils and the eosinophils, which are the first responders to go out to the site to see, is there a pathogen we need to control and take care of? And we also see platelet activating factor with the signs and symptoms of hypersensitivity reactions, such as allergic reactions. Plasma proteins are also important because they bring clotting factors, complement, and vasoactive peptides to the site. Remember, if you have an injury and you've got bleeding going on, you need to get those clotting factors to that area to help control that bleeding. So they're helpful, especially if there's an injury. Now, I'd like to clarify a few things about inflammation and infection. Inflammation and infection commonly coexist, but they have an interesting relationship. We know that infection will always cause an inflammatory response. However, inflammation may not cause an infection. And if you think about that, if you have a trauma or an injury, You get an inflammatory response, but it doesn't cause an infection. So if you twist your knee while you're running, you get inflammation because there's been tissue that has been injured. And so you said all of those healing factors to that site to start tissue repair. However, it doesn't cause an infection. Let's talk about the etiologies or the causes. The causes of inflammation include an immune response to an infection. Okay, we talked about that. Trauma or an injury, and surgery can be one of those traumas or injuries because if you're cutting open your skin, that's going to be traumatizing to the body's skin tissues. We know that chemicals can damage tissues. Thermal extremes, frostbite, or burns can damage tissues. And we know that ischemia can damage tissues. And remember what ischemia is decreased blood flow and decreased oxygen at an area. So if you have ischemia to tissues, they're going to be damaged and you're going to see an inflammatory response because of the trauma associated with that. And we also know that some chronic disease states can also cause inflammation. The manifestations of inflammation are things that you're used to looking for: redness, swelling, warmth or heat, pain at the site, or even loss of function. Maybe not being able to use that area, or perhaps that area is not functioning as it should because of the inflammatory process. And last, the word term itis that is on the end of words sometimes helps identify inflammation. So cellulitis is actually inflammation and infection of the subcutaneous tissues. Like if you have a bug bite, you can get a cellulitis. Or tendonitis is inflammation of the tendon. Maybe you overuse that tendon when you were at the gym or playing a game of tennis, and you ended up with tendonitis. All right, so let's move on over here. Oh, we're going to move that little guy over. Let's move to our next column here. Let's talk about acute and chronic inflammation. Now, acute inflammation is a short duration. And acute inflammation is aimed at removing the agent if it's a pathogen and limiting the tissue damage. So always with acute, we're talking probably, less than maybe 6 to 12 weeks. So it's short term. And we know that acute inflammation is actually helpful. It gets the agents to the site where we need to start that healing process or control the infection, and it should resolve in a few weeks. There are three stages of acute inflammation. The first stage is the vascular stage. Now, in the vascular stage, this has to do with the vessels. Initially, at the instant of the injury or the infection, the vessels constrict. Okay, that's to stop any bleeding that might happen. And that would be to stop any bleeding. But then what they're actually going to do is dilate. And this dilation helps bring nutrients to the site. That could be oxygen, um, tissue healing agents. Also, that could bring neutrophils to help control an infection. And that's where you see that heat, redness, and swelling that we talked about. The second stage is the cellular stage, and that's where the leukocytes and the neutrophils actually are at the site. And they start this phagocytosis. So it's the bringing of those leukocytes, neutrophils to the location to see, is there infection present and do they need to gobble anything up? It also, you'll see the release of those mediators, histamine, cytokines, platelet activating factor, and the plasma proteins. However, if this is not needed, then they just go away. So these may not always be needed, but we're going to send them there just in case. The third step is phagocytosis, and that's where the neutrophils actually engulf any infection or debris. We also know something called opsonization occurs. And opsonization is actually when we have the antigen antibody binding so that the adaptive immune system can start to cycle up. So we're going to actually present those antibodies and those antigens to that adaptive immune system so that we can actually get that going if necessary. Now, sometimes we have what is called an acute systemic response. When it becomes systemic, that means it is not localized. So now it's throughout the body. Our goal is really to keep infection or injury or anything that's gone wrong at the tissues at the site and keep it localized so it doesn't spread throughout the body. But sometimes it gets loose and it spreads throughout the body, and we have what's called an acute systemic response. In those particular cases, we're going to see whole body symptoms. We're going to see fever, lethargy. We're going to see an increase in some of these inflammatory enzymes. And these lab values of ESR and C reactive protein are going to increase. You may see lymph nodes that start cycling up. And in severe cases, you can end up with sepsis or even shock. So we really don't want that acute systemic response, but sometimes it does happen. Let's talk a little bit about chronic inflammation. Chronic inflammation is really not very helpful. With chronic inflammation, we're talking about longer duration, maybe even years. Okay, so it's not really going away. What we see is a recurrent and progressive process where maybe it kind of exacerbates and remisses, but it doesn't really go away. What we see is this kind of low grade smoldering response that fails to evoke a really good acute immune response. And so you see this low level chronic inflammation. And this low level chronic inflammation actually starts to damage the tissues because it doesn't go away. And so it damages tissues over time. This is really when the immune response is, or the inflammatory response is not working well, and we can't seem to get rid of it. So, like I said, inflammation in the short, acute um, term is good, but when it goes on chronically, it's really serving no purpose and it's actually causing more trouble. We see this leading to disease states such as chronic arthritis, cardiovascular disease, maybe autoimmune or autoinflammatory disorders, diabetes, those types of things. So let's move over and talk a little bit about wound healing. We'll move this little guy as my little examples. We'll move him over. Well, maybe we'll move him over here. That might be better. All right, so let's talk about wound healing and the process of wound healing. So, wound healing can occur by two different ways: primary intention or secondary intention. Primary intention is when we have a small, clean wound and we're healing from the top down. It's when the wound edges can come together. So this particular example right here, where there's stitches, if you can bring those wound edges together, then that's going to heal by primary intention from the top down. There's going to be less scar tissue, less infection, and it's going to heal faster. Secondary intention actually is a slower process. It's usually larger wounds where it's gaping, the edges cannot come together, and it has to actually heal from the bottom up. So it has to fill in that tissue. And so we got this picture right here. You can see these edges are not well approximated at all. And so what has to happen with this wound is it actually has to fill in and heal from the bottom up, and it takes a lot longer. So it's a longer process. There's going to be more scar tissue and an increased risk of it getting infected. Obviously, we would love to bring those edges together and heal them by primary intention, or sometimes they come together on their own. There's just a small wound, but sometimes that's not the case. There's also something called a delayed wound closure. And in some cases, we have a big open wound and we have to leave it open to drain. Sometimes we see this with animal bites, maybe a dog bite or a cat bite, and we can't close those edges together because the wound is too dirty. And in those cases, we have to put a drain in place and let that drain some of that infectious pus and fluid out of there, and then we can remove that drain down the road, and that can either heal by primary intention or secondary intention. So sometimes we don't bring it together on purpose because we want it to be open so that we can manage the infection. Now, healing requires several things. It requires proper nutrition. So, we have to make sure that we have enough nutrients. So, if your person is malnourished, they're not going to heal well. They're going to slow down their healing. We need proper blood flow to make sure oxygen and nutrients can get delivered to the site. We need an appropriate immune response, not too much. You don't want chronic inflammation. And we don't want infection. Infection is going to slow down the healing process. So healing requires all of these things. And we also know that um, as we get older, healing slows. We also know that increased blood sugar, like in diabetes, that's going to slow healing as well. And let's talk about wound exudates or drainage. There are four different types, and we can sometimes combine some of these and put them together. The first is serous. Serous is watery, low in protein, more of a clear yellow. See this guy right here? He's very serious. So that's serous fluid. You can also have sanguineous or hemorrhagic fluid, which is blood, and that's kind of red. And you can have serosanguinous, which is kind of a blood tinged, kind of a clear fluid. So maybe the blood's not as bright because it's not as much. It's kind of watered down with the serous. We can have purulent or suppurative drainage, which is pussy, and that's usually yellow and green. So we got a cat here because he purrs. He's purulent. He's kind of a green cat. And that's usually full of white blood cells, debris, and that's really a sign of infection. And then you can have fibrinous exudate or drainage. And fibrinous is thick and white and sticky. It's kind of more of a meshwork. So it's trying to kind of close that tissue in. The last is wound complications. And there's a couple wound complications. First of which is hemorrhage. I mean, you can actually have bleeding from your wound, and that would be a complication because you have to stop that bleeding before you can heal it. You can have infection, which we know is going to delay healing. You have to clear up that infection. So if your wound's very red and inflamed, it may be from infection, not just the trauma from the wound. We also know there's something called an abscess formation. And so let's bring this guy a little bit bigger here. This right here is an example of an abscess. So down here, and this is a tooth, so you can get an abscess anywhere, but a tooth abscess is usually a pretty common one to talk about. So what you got here is this yellow infectious pus, and it's made a pocket of infection right there, and that is an abscess. And this abscess causes pain, okay, and it's bacteria and pus, and you actually have to kind of remove it or drain it, because it's kind of hard to not remove it. You're going to have problems, and it's going to be hard to just kill it with antibiotics. So usually abscesses need to be removed or drained. Actually, we should write drained. The next is wound separation. And your wound can separate two ways. It can dehiss or it can eviscerate. I don't have a picture of evisceration, but evisceration is when the insides spill out. So the wound opens, and in some cases, it's so swollen that the stuff inside, like tissue inside your body, actually protrudes out of the opening. It's so swollen. That's called evisceration. You can also have dehiscence. And this is a good example of dehiscence, where the edges just separate. So that we'll say is dehiscence. So really, evisceration is a dehiscence with the insides coming out. And the last wound complication is a fistula formation. And that is this picture here. A fistula is an abnormal connection that shouldn't be there. And so in some cases, a wound can develop a fistula, which means that it actually communicates with another part of the body. Let's say you have a bleeding ulcer in your stomach, and it has eroded all the way through your stomach wall. And now the contents of your stomach is actually spilling out into your peritoneal area. That could be a fistula because it's kind of eroded all the way through. All right, and here you go. There's your final map. So I recommend viewing our video on altered immunity next, as it's going to cover some aspects of the excessive immune response, which includes allergic reactions and hypersensitivity reactions. Again, if you find our videos helpful, remember to like and subscribe so you're up to date and receive our new videos. Have a great day.